Hi, I'm James.
And I'm Anthony.
And this is Words and Numbers. I'm going to channel my inner Italian and just say, hey, how you doing? When my children were little, I told them that they said hello in Italy and that they were in fact speaking Italian. They bought it because they believed everything I said back then, and it was probably a better kind of life.
Isn't that great? I had so much fun messing with my kids' heads when they believed everything I said.
They once asked me why I hated the Yankees so much, and I said because they mugged me one night. That I was up near Yankee Stadium, and they all came walking out of their locker rooms, and 15 of them descended upon me and stole my shoes. They believed this for years.
When the kids were little, you'd put on a video, the VHS tapes. And at the beginning, and they don't do this anymore on movies, but at the beginning it was the FBI warning saying that,
yeah, right.
Don't copy this, da-da-da. And so from the time the kids were little, the FBI warning would come on, and I'd salute. And I'd tell them, you have to salute. It's the FBI. And they'd stand up and salute the FBI. There was no mention of it, right? I mean, they're kids. They just accept anything that you do. So this goes on, and my daughter hits public school as a kindergartner, and she's there doing her thing as a kindergartner. And one day the teacher puts a video on.
Yep.
And
she's going to look like a real idiot.
The FBI warning comes up. She stands up and salutes, looks around, and everybody's looking at her. And all of a sudden, it hits her that she's been had.
Yep, and there it is. So I guess we have to get to this, much though it pains me. What's new and exciting in your world this week, Ant?
In 2011, the then Transportation Secretary, Ray LaHood, announced that the government was going to spend $450 million to bring high-speed rail to New Jersey. This culminated in what we now know as the Acela line that runs basically from New York City to Washington, D.C. The project was supposed to take 6 years. It actually took twice that. And when I say actually took, it's actually still in process, but they're expecting it to be done in the next couple of years. So it would have been more than double what was anticipated. The point was to build a new Acela fleet that would run at 160 miles per hour versus the current 135. Now, the problem here is not with the trains, but the rails themselves are so old they won't take that much strain. And so you get these high-speed trains now that can run at 160 miles an hour, but they can only do that over 20 miles of track. The rest of the track can't handle the train going that fast. If you do the math on this, you find that this $450 million upgrade saves the average passenger a grand total of 100 seconds.
Almost 2 minutes.
Right, almost a full 2 minutes that you save here for $450 million. Now, if you dig into the numbers, you find there are 3.5 million riders per year on that line. So that's a total savings of 97,000 passenger hours per year. If you assume the average rider earns, let's take the median household income, $67,000, and you can argue one way or the other it's going to turn out, it doesn't matter too terribly much, but let's suppose the average rider earns $67,000. That means that the value of that 100 seconds per passenger totals about $3.1 million per year. So in other words, the $450 million investment is saving, in terms of people's time, the equivalent of $3.1 million per year. $3.1 million on a $450 million investment, that's a return of less than 1%. It's not making up for inflation back when inflation was nice and low. Forget about inflation now. Less than a 1% return on a $450 million investment. But wait, it gets worse. Because along with the train upgrades, Amtrak upgraded the Moynihan train station in New York City. Those upgrades forced the passengers who needed to change concourses at the station to take a more circuitous route that ended up costing them about 100 extra seconds of walking time.
It's the same in the wash.
So when you're done, you've got a $1.6 billion station refurbishment negating the $450 million train upgrade, leaving passengers no better off than they were before. And the problem here is that Amtrak is not a profit-motivated entity. And people say, well, it's horrible, these corporations are only concerned about profit. Look, one of the great things about a corporation being focused on profit is that they will do exactly the calculations I just did here and say, look, this upgrade is not worth the amount of money that we're putting into it, or it is worth it and we do it. But the fact is, Amtrak isn't profit motivated, and we're never going to get a profit motivated train system so long as Amtrak exists, because no profit oriented entity can compete with the government subsidizing Amtrak.
This has to be true of at least the last 20 years of my life. What ends up happening is every year or so, I think, let me take a train. Surely that will be better. And I think it would be better, right? You've got more room, you've got a workspace. It provides you some entertainment as you look out the window. And yet I have never once taken a train. Why not? Because it costs roughly 3 times what it costs me to fly.
In my experience, it's cheaper than driving, and roughly, for the places I go, roughly equivalent to flying. But the big thing with me is I can't rely on it. It might be on time. It might be 11 hours late.
Well, you're not doing any worse there than you would with American Airlines. Let me just throw that out there. Any way I cut it up, it's not worth it to me. And if it's not worth it to the travelers, why on earth are you spending taxpayer dollars on it?
Exactly.
It's not worth it to such a degree that if we shut it down, it wouldn't matter. You know, usually you stroll in and you start squawking about data sets and Pew Research and nonsense like this. And I usually just roll my eyes and quietly endure the pain that comes with this sort of thing. But today, Aunt, I've got a batch of Gallup polling data. I didn't know this, but Gallup has been measuring confidence in various American institutions since 1973.
Yeah.
You've got a lot of longitudinal data here if you really want it. I'm only going to work with what the presentation in the article gives me, which is 2021, 2022. But we'll post the article with the URL online. Anybody who wants can go dig into it further. The question boils down to how much confidence you have in various institutions in American life. And this goes far beyond the 3 governing institutions, even though those are the 3 we're going to care about. How much confidence you yourself have in each one of these institutions. A great deal, quite a lot, some, or very little. Congress's confidence level is remarkably low, lower than anybody really thinks it would be. And the Supreme Court, very much higher than anyone should really ever think. I think you can explain this by saying everybody can see what Congress is doing every day if they want to. Mm-hmm. And if you turn on the news, you see congressmen and senators bloviating all night long. And nobody knows what the Supreme Court does until, last week or so.
Right.
So, of course, they think well of the Supreme Court because they had no idea what it does.
Mm-hmm.
But now they know what it does, and everybody's going to be pissy. You also know that Joe Biden not lighting up anybody's poll at this point, right?
Yeah.
His is already such a failed presidency that I don't think he can come crawling back. But having given away the answer, I'm going to now quiz you. What do you figure Congress's approval level is in this Gallup poll?
I would be very surprised if it's more than 30% favorable. I would not be surprised if it's less than 20% favorable.
I would also be surprised if it were over 30% favorable, because last year it was 12%. Hold the phone now, because that was last year. This year it's 7%.
7%. Now, look, as a statistician, I have to tell you, when your results start coming close to a barrier, in this case, the barrier is 0, you can't go below 0. It's really, really stinking hard to get a result that's close to the barrier like that. You have to have almost everybody saying no. 7%.
Which brings us, of course, to the presidency. Last year, President Joe Biden came in at a whopping 38%. That is close to the all-time worst that a president has ever come.
Really? Who's the worst? It's probably Carter during stagflation, I bet you.
I think the correct answer, Ant, is going to be that it's Joe Biden this year, because last year was 36%, or 38, my mistake, but this year is 23.
All right, now hang on, because I know this number off the top of my head. When Trump lost that election, he was 42%.
And don't forget the 2 impeachments.
Right.
Yeah, 23%.
So almost double what Joe Biden is currently. My God, that's incredible.
But wait, there's more, because finally we have the Supreme Court, which last year pulled in at 36%, which is a little low for them, actually. This year, 25%.
Let's recap. We've got the three branches of the federal government at 25%, 23%, and 7%, which means there's a supermajority of Americans who are displeased with each of the three branches.
Where do I sign on? Yes, that's me.
God, that's incredible.
I am displeased with all three branches of our government, but I always have been, right? I have seen with my own eyes what government can and cannot accomplish. The more they think they can accomplish, the less I trust them.
God, that's astounding. You said this is Gallup. This is a decently random sampling of Americans. It's not crazy people they're finding.
And let me throw a couple of more numbers out there because we can really put this in perspective when we balance America's governing institutions with other kinds of institutions. The institution, and this is at least for the second year running, the institution that most Americans favor, small business.
How about that? You have a number on that?
68%.
68%. Small business.
Mm-hmm. Second is the military at 64%. Believe it or not, third is the police. Not the rock band, but, those guys with badges. 45%. As pissed off as Americans are with the police, and they are.
Yeah.
They're closer to the top of this than they are to Congress.
They like him twice as much as Joe Biden.
I would hazard to guess that Joe Biden's numbers are sinking well past this even now. What comes in just ahead of the Supreme Court, which was, remember, the highest of the federal bodies, large tech companies. People wander around saying that they can't stand large tech companies and that they want who? Congress to regulate them.
Right.
There's something in the water here that doesn't smell quite right. I'll leave it to the listeners out there. They are smart people. If they weren't, they'd be listening to some other podcast.
That's right.
They're actually pretty bright. Send anything in that you are able to uncover on the data. If you find it interesting, we'll talk about it some other time. But, Ant, it's hard to understand how we could go from a 7% Congress to the foolishness of the week. But that just proves how strong the foolishness of the week is this week. And I want to bring us to that thriving metropolis, San Francisco. Every day, people there wake up and they think to themselves, how can I regulate things better than they've already been regulated? I want to draw your attention to driveways.
What is wrong with driveways that needs regulating?
That's a great first question, but let's punt on that one and ask a secondary question. What are driveways for?
Parking your car.
Right, so for a fact, having been to San Francisco, that most of the houses there don't have garages. They're tiny houses. They're built one on top of the next. Why not leave your car parked in the driveway? Nothing bad will become of it because the weather there is just not such that you're going to have a problem.
Right.
The thing that you have more of a problem with is people breaking into your car because it's always out. But here comes San Francisco officials. They fined a couple for $1,500 for parking in their own driveway.
What's the problem there?
You're not allowed to park your car in the driveway.
You're not allowed to.
It's against city code. These poor people received a $1,542 fine for parking on their own property with the threat of what? A $250 per day fee if they didn't get the car out of the driveway.
And put it where? They wanted to park on the street, I assume?
No, you can't park a car on the street. Come on, what's wrong with you?
What do they want them to do with it?
Well, I think that question went unanswered. Would you even think to look in the city code to learn about parking? Or would you, like every other American, think that your driveway was plenty good enough?
Right.
I would never have consulted with a code book to find out if I was running afoul of the city laws. And these people weren't either. None of them had the first idea that they were offending the great regulation monster in some way. Except it wasn't just these people. Where two other people on the same street got the exact same fine.
Huh.
Why? Because someone in the neighborhood had turned them all in.
Oh.
Somebody dug through the code and decided he could get his neighbors good by doing this. He'll be anonymous for the rest of his days.
Uh-huh.
Nobody will ever say who it was. But he's actually one of those tiny men that will use the force of government to screw over his fellow citizens. Instead of walking over like a grown man and saying, I have a problem with what you're doing here. Can we reach a conclusion of something?
Right.
That's what grown-ups do. Well, not so much any longer, and certainly not in the great state of California.
I think there's something about some people that they actually get some kind of satisfaction from forcing other people to do whatever it is they want. In our book, we talk about the busy bullies. I think that's exactly what this is. That someone saw an opportunity to force other people to conform to their will. I would imagine what's actually happening on the back end, if there's a car or there isn't a car, is of secondary importance to the busy bully. What's of primary importance is I got them to do what I want.
A friend of ours, Randy Simmons, was mayor of Providence, Utah, a town that I lived in. I did not live in it when he was a mayor. And he said, when I was mayor, every day somebody would come to me and say something like, my neighbor's dog barks too much. Mm-hmm. And I would say to the man, and what happened when you confronted your neighbor about that? And he said every single time the answer was, well, I didn't do that. That's your job.
To get more Ant and James, buy a copy of our excellent book, Cooperation and Coercion. You can find the paper and electronic versions on Amazon and the audio version on Audible. If you'd like to support Words and Numbers, make your way over to patreon.com/wordsandnumbers, where you can contribute to our podcast-making habits. If you'd like to schedule us to come speak at your event, be it corporate or educational, or have James officiate at your wedding, send us an email at wordsandnumberspodcast@gmail.com. This episode is longer than our usual 30 minutes or so that we can treat this more complicated topic with the detail it deserves. Christy Ford Chapin is Associate Professor of 20th Century U.S. Political Business and Economic History, as well as Capitalism Studies at the University of Maryland. She is published in the Journal of Political History, Studies in American Political Development, and Business History Review. Her book, Ensuring America's Health, the Public Creation of the Corporate Healthcare System, won the 2016 Ralph Gomery Prize from the Business History Conference. Professor Chapin is currently a visiting scholar at Johns Hopkins University. Christy, welcome to Words and Numbers.
Thank you for having me.
I posted something on Facebook about a week or so ago about problems with our healthcare system, and particularly it was relating to a recent episode which James was complaining about his inability to get pain medication because of ramifications of the war on drugs and this sort of thing. And somebody responded, you've got to talk to Christy Ford Chapin about how the U.S. is in the system that it's ended up with as far as healthcare and pharmaceuticals are concerned. So we're asking you on to tell us what you can.
Well, because I'm a historian, you know how we are. We like to go all the way back 100 years or more. And also we like to look at primary sources, the sources that the people making the history are generating. And I just love our methods because by doing that, I discovered a lot of things about the healthcare system that I was not expecting. You read a lot of accounts that are already out there in the literature, the secondary sources and stuff. And a lot of it is great. I don't mean to act like everything written on healthcare is bad. A lot of it is great. The question has generally been, why are we not like Northern Europe, Western Europe, and Canada?
Right.
And that's been great for looking at the distinctive form of the U.S. system, it being federalist. You know, we don't have a parliamentary system and large reforms are difficult to get through. But my question was, why does the system look the way it does? And two of the big things that the story I uncovered explain are the unusually high costs and also fragmented care. A lot of your listeners will probably know, they've heard a lot about U.S. healthcare costs. If you look at our healthcare costs compared to other countries, you see there's some kind of problem going on. You can't just say, oh, we have great care. Okay, but why are we spending almost 1/5 of our GDP on healthcare costs?
And how does that compare to other countries?
That's a great question. We're up around 19% more or less. And if you look at the second place countries, they're all the way down at 12 and 13%. And they have healthcare cost problems as well.
Right. Okay.
But if the second place people are that far behind, something else is going on besides quality of care. And I do think it's hilarious when people act like Cuba is the place to go to get your healthcare. That's a lie. American healthcare is far better. People aren't flying from all around the world to go to Cuba for a reason, because their healthcare is terrible. And why you would believe their statistics, I don't know. Nevertheless, although we do have a lot of great healthcare here, it tends to be for people who have good insurance or who can afford it. And one thing that really reduces our quality of care is the fragmented system we have, where It's really hard for people who either have a lot of different illnesses. This tends to affect elderly people, or somebody who has an illness that they cannot figure out what it is, something is wrong with them. The way our system works is they start with their general practitioner and then get referred to a specialist. They do everything they can according to what the insurance company says they can do. They run through all the billing. They send them to the next specialist, and they could die in between specialists. That information doesn't even get fed back into the system, which you can imagine is not good for improving quality and figuring things out and learning on the job. So those are two big problems that I uncovered by figuring out how the system develops.
Let me stop you there for a second. When you say our system's fragmented, it sounds like what you mean is fragmented by treatment.
Yes.
Why do we have a fragmented system? Presumably it's trying to address some problem.
Right. When they practice in a group, it's all the same specialty. And I think a lot of people assume, well, why not? That's just the way medicine would naturally develop. That is not the way doctors wanted to practice, and for good reason. If you go back to the beginning of the 20th century, you'll find that physicians, I think very wisely, were opening multi-specialty practices because the idea was a patient and everybody in their family would want to come and have one-stop shopping. And it's kind of understanding that healthcare, that's the way it is. If you have an illness, it doesn't necessarily respect the boundaries of disciplines of medicine, right?
Right.
And especially if you have more than one, it can get very difficult. Theoretically, in our system, your general practitioner is managing all the different specialists in your care, but any general practitioner would just laugh hilariously, as if a GP has time to manage that kind of complex. You're lucky if they have time to talk to your specialist, and the amount of time they're spending every day just doing paperwork, not even seeing patients, but just doing paperwork, because basically it's got doctors working for insurance companies and also the government to some degree, but really more than anything, it's about an insurance company model, because even the big government programs, Medicare, Medicaid is a little different because it expresses itself differently depending on the state. But a lot of those programs are run and administered by insurance companies as well.
It's funny because I didn't stop to think of it till you're talking about it now, but it sounds like somebody looked at how we build houses and said, well, we've got a general contractor, and under them, we've got an electrician and a plumber and someone else, and we'll just let the general contractor handle things, and said, well, that's a good model. Let's use that for healthcare. And you point to the insurance companies. How is it that the insurance companies landed on this model?
And this is the thing that confused me when I was looking at it, besides the cost and the fragmented care, is why are the insurance companies at the center of everything? Why do they have so much power? What your audience needs to understand is a treatment really doesn't exist unless the insurance companies acknowledged it and agreed to pay for it. Same with a medicine, a drug, whatever it may be. I think people do not realize the degree to which insurance companies dictate the care that your doctor can give you. A lot of the art of medicine has been swept away, which is sad for physicians because then they have to go by standardized treatment blueprints. Another hilarious irony of the whole story, besides the fact that physicians now practice this way and originally had practiced in multi-specialty groups, is that insurers never wanted to be this involved in healthcare either. What happened was physicians started these multi-specialty groups. They were usually called prepaid doctor groups, prepaid physician groups. Some people might recognize them today. Now we have, I'm trying to remember what they're called. I think they're called direct practice.
I've got one here in Pittsburgh. It's a fascinating thing. He doesn't take insurance. You come in, you pay cash or credit card or something.
Exactly. So they are on the road. That is like a nascent form. I'm like, oh, it would be so neat if they were able to figure out how to do that multi-specialty, but they have to figure out the piece of breaking into the hospitals. But we can discuss that once we look at the history, because once you look at the history, everybody's like, okay, healthcare in the US is important. It eats up almost a fifth of our GDP, but wow, it's complicated. But when you just explain the story, a lot of complication becomes very simple and it all falls into place. And you're like, oh, okay, that makes a lot of sense. Early in the 20th century, what physicians were doing is getting together in multi-specialty practices. There were not insurance companies. Insurance companies did a little of experimenting with healthcare, but it didn't work well. So they were staying out of it and they didn't want to get back in. Basically, these physician groups would be multi-specialty. So you'd have the physician, obstetrician, surgeon, ophthalmologist, one-stop shopping. But very interesting from a financing point of view is they were also the insurer. You paid monthly to them.
Right.
And it aligned the incentives the way they needed to be aligned. Okay. So under the current insurance company model, because of the way physicians are paid, and they fought tooth and nail to make sure this would happen in 1930s when they were constructing this model that we all now live under, The way the physicians were paid under the prepaid group model, it forced them to walk that line between overutilization, providing too many services just to run up a bill, which they do today. It just makes sense. It's called fee-for-service payment, which means that the insurance company pays the physician not just for your office visit, but for the office visit and then any other services and procedures they give you during that visit. This is nothing against physicians. They're responding to incentives just like professors, journalists, and everybody else does in their profession. But it incentivizes them to run up a bill. Oftentimes they're thinking, I'm making up for my Medicaid patient who I'm not getting paid enough for. I'm making up for this, or I'm giving them gold standard treatment that I'd want my sister or father or mother to get, something along those lines again.
Right.
But under the prepaid group model, because they acted as the insurer, there was no incentive to just run up the bill because that would just be coming out of their back pocket.
Right. They're the ones paying it.
Exactly. So why would you? So if you look around the world, the problems you see in every single system is either overutilization, excessive services for those who have good insurance or the money to pay for it, or you see rationing of care. We're not incentivized to ration care either because they want people to say, this is a great place. They take such good care of us. Also, you don't want your patient to get sick. So if you can take some simple steps, a little preventative medicine, a little this and that, again, it's going to benefit your back pocket. All these things help you. I argue that the physician is the one you want to make sure those incentives are correct with. A lot of people focus too much on the patient's incentives. Yes, if they have insurance, they can more easily go to the doctor, but there's some hypochondriacs out there who want to run to the doctor for every little thing, but most people are either busy or they don't want to go to the doctor.
Right.
And I maintain because of their training and the expertises you have to have in order to be a physician, they're the ones who need to be incentivized correctly to walk that very fine line between overutilization and rationing of care.
So this model you've just described, which used to exist in this country, and I'm kicking myself here because I'm an economist, and that arrangement never occurred to me. It makes perfect sense to set it up that way. So we moved away from that for various reasons I could probably hypothesize, but you could tell us. But I'm interested equally in why we aren't reverting to that. What's standing in the way of a bunch of entrepreneurial doctors getting together and saying, hey, this makes sense?
They have to go to states and lobby to get a lot of laws that were passed in the 30s and 40s, thanks to the American Medical Association repealed. Before they even started these direct primary care practices, they had to do that. For example, there are a lot of laws on the books against the so-called corporate practice of medicine. People cannot believe this story, but that's the way history is. It's really is truth is stranger than fiction. But a lot of people know the American Medical Association, which represents organized physicians. A lot of people know that they're famous for opposing government's intervention in healthcare. Because of that, a lot of people have assumed that physicians were pro-markets. My joke is that the AMA leaders were rolling around with their Adam Smith ties and they were all about the free market.
Right.
Nothing could be further from the truth. They would have rather the government get involved before they wanted anything to do with a market or competition or pretending, because to them it was, how dare you even insinuate that us physicians with our expertise and all our scientific knowledge, and we have to balance science and art, and we reach into the jaws of death, and this is the way they're thinking of themselves. How dare you say that we should get involved with the dirty, crass commercial marketplace? That's not for gentlemen.
It's too important to leave to the vagaries of the market.
Exactly. They were offended by the idea that physicians would compete against one another. That was very much against their professional model. They were holding on to kind of a romantic 19th century image of the single physician on horseback with the black bag. So they were against insurance. The AMA, believe it or not, was against private health insurance.
Wow.
Yes. So they were very much opposed to these prepaid physician groups. They were opposed to them because people were paying a monthly payment. Prepaid back then was a synonym for insurance. Just the fact that you had a group together and they were multi-specialty. What's hard for us to think of today is how at this point in time, we're kind of used to living with large corporations. And even though there's pushback politically against them, what was going on in the late 19th and early 20th century is you had a lot of the professions in the middle class reacting to the rise of corporation. What the physicians are thinking is, we don't want to be like the engineers. We don't want to be captured by the corporation, brought into a big bureaucratic hierarchy, and then made to work for a layman who doesn't have our expertise. You can understand that, but because of that, they shot themselves in the foot. The model they end up designing works great for physicians for a few decades, but then it ends up that the very corporate model they wanted to avoid is what we have today, the insurance company model, where physicians pretty much work for the insurance companies.
Yeah.
So what happened was you had a lot of these prepaid physician groups. I mean, hundreds and hundreds of them around the country. They were wildly popular. They're very popular with the progressives. And actually, if you look at Truman's proposal for universal health care at the end of the 1940s, they wanted to keep Blue Cross Blue Shield, which was still the insurance company model, but they really wanted to rebuild the system around the prepaid doctor groups because people recognized that patients were very happy with it and that it controlled costs and it offered really good health care. And Blue Cross and the other insurance plans that were getting off the ground just weren't able to offer as many benefits because they couldn't control costs the way the prepaid physician groups could. For example, in the 1930s, to have a health insurance that covered obstetrics and having a baby, no insurance company could do that. It was just impossible. The costs were just too much. The moral hazard of somebody buying insurance because they knew they were going to get pregnant or were going to have a lot of pregnancies or whatever it may be, they couldn't. Blue Cross in New York offered it and then promptly went bankrupt. So
Wow.
for a brief period of time, I think it was late 30s, early 40s. That tells you how that insurance company model was developed. And I'll explain why that happened. Briefly, what happened to prepaid physician groups is they were one of many different kinds of models that the market was experimenting with at this time for the delivery and financing.
This is around 1930s.
Yeah, we're in the 30s. This stuff had gone in the teens, the 20s, 30s, been building up tons of different models. I don't want to give your audience the idea that prepaid physician groups were the only model, but I believe they would have been the dominant model because people were just so happy with it. But you had models that were consumer cooperatives. You had union-led plans where they were like the managers over the physicians and they would bring the physicians in on salary. You had fraternal orders and mutual aid societies where they would pool their money and just have a doctor on contract. You even had some Black mutual aid societies that were so big that they could build their own hospitals.
Wow.
And then the people who paid dues to that fraternal organization or mutual aid society often would have life insurance through it and then often some type of health benefits. They were all better at controlling costs, but I do think the prepaid group model would have been dominant. I think as they grew, what would have happened is they would have reinsured on the back end.
Right.
Like today, you're talking about a patient hits $500,000 in costs. Then the insurance kicks in, but insurance companies would be very much farther in the background and not quite so, hey, we're right here in the middle of the healthcare system practicing medicine ourselves, right?
Right. They'd be insuring the practices rather than insuring the patients. The practice would insure the patient.
Right.
That makes sense.
And I do think too, what would have happened, people think, oh, but you only have your doctor in one area. What would happen? Just like if anybody has studied the history of banking, these things work out pretty easily. You just set up networks and credits. This person's traveling, and so they get care over here. Very similar things are easily set up in other sectors. So I don't think that would have ever been an insurmountable problem.
And let me pause there for a minute, because it's not just that this crossover between sectors is easily set up. There's a profit incentive to set it up. Because if Dr. Group A has cross-state relationships like this and Dr. Group B doesn't, I as a patient am more likely to go with Dr. Group A.
Exactly. Everybody's being incentivized to do all the things we want to see. I mean, could you imagine if we had this healthcare system today? Doctors would be like, oh, I need to get all my diabetics in a nutrition class and I'll just give them for free.
Right.
They would have nutritionists on. They'd probably have a van to go around and pick up the elderly.
But think about the analogy. When your insurance comes through your employers are doing exactly that. I just got an email the other day about I can get X% off of whatever the university charges me for health insurance if I participate in some health wellness program. We're already doing that under the perverse model, but certainly, yeah, you're absolutely right. It would work under that model.
Right. And with the employer provision, you get one or two, maybe three choices if you're at a really good company.
Right.
The employer provision, it's going on since the beginning of the IRS after 1913. It was just a loophole. They had decided that if companies were paying for benefits for workers, they could write it off. It started being looked at more heavily in the 40s and early 50s because policymakers realized that because of that write-off, they were losing millions of dollars of potential tax revenue. But then I believe it was the 1954 Tax Act that it was institutionalized in legislation that we're going to let them have this write-off. Of course, the story I think a lot of people have heard is, employer provision spread a lot during World War II because the wage and price freeze, and this was a way to bring in workers. That's not really quite true.
Now, hang on, because I tell that story all the time.
Sorry.
You're telling me it's not true.
Yeah, if you look at the growth, it's not unusual from what you would expect. It's pretty steady, but you do start to see it really creeping up around then. But yes, exactly. They have tax write-off and everything. I would say more than anything, you've got to look at the fact that it's the tax write-off. But that market was growing anyway. And a lot of companies were already in the 30s, for example, looking for these healthcare benefits to squash union organizing. That was one big, huge reason, mainly actually, that companies wanted to do it. Jennifer Klein, she's a historian at Yale, has a good book on the piece of who was going to get control. Was it going to be the unions or the employers? And the employers and the insurance companies ultimately won that battle. What had happened with these prepaid doctor groups, you have all these models, as I had said before, and pretty much all of them, the AMA went after. I mean, every single one. And it was easy for them to do then. They could not do something like this today. They were far more powerful. I would say before Medicare was passed, for example, in 1965, the AMA was far, far more powerful. The medical licensing boards, they pretty much had a lock on those. It was AMA physicians in those. So if any physician did anything that the AMA powers that may be, which they're headquartered, the national organization association is headquartered in Chicago, but every state had one. Every county or city had a constituent medical society. So you cannot escape the AMA. They were in every corner of the United States, which is one thing that made them so powerful, because they could lobby every single level of government, and they're physicians in a very respected profession. So they would tell physicians, we're against health insurance. We're afraid of corporate power getting in here. They also didn't want to have the market too organized because they thought that would make it too easy for the government to then step in. They were looking at Europe for that precedent. So they threatened physicians and were pretty much, we're going to come after you and get your license revoked.
Oh, wow.
And that is what they did. They got their hospital admitting privileges revoked, which was easy for them to do because they pretty much controlled hospitals. That's not the case anymore. But then they could snap their fingers, have your admitting privileges stopped, certainly have all your referrals if you're a specialist stopped, because everybody in the society would follow along. If you think of an old boys network, this is the model right here. In fact, I even like to laugh and think of when they invented the healthcare model we have today, which is crazy when you think about it, because the market did not create this model because it's such a ridiculous model. They invented it, and I just have to imagine them in a cigar smoke-filled room at Chicago. Come on, of course I've got to think of it. A bunch of old boys club just inventing it. So what happened is, the AMA was busy in the teens, 20s, and 30s destroying the healthcare market, whether it was mutual aid societies, union welfare funds, consumer cooperatives, or these very popular prepaid doctor groups. The AMA was going after all of them. Even some physicians who had been presidents of their own local medical societies or who were really famous and well-known, they went after them. They didn't care if it got written up in the media. The only people who got protected was if somehow they could get political protection themselves. Some of them were in with the farmers in certain states. They could maybe sneak by, but even hiring became hard because of the threatening. So you have in like the Journal of the American Medical Association. Think about this is one of the preeminent medical journal. It still is, but back in the 30s, it already was too, in the world. And they're printing articles that are saying, we will come after you if you are involved. If you have a contract with any of these types of models, we're going to come after you with everything we have. So they did a really good job of destroying the market as much as they could, which on the other side kicked up the call for political proposals and the call for the government to intervene. And we're in the 1930s, the Great Depression, you have all these unprecedented experiments with the federal government. And of course, because of the AMA's own actions, healthcare is very low-hanging fruit.
Right.
That's why with the 1935 Social Security bill, which really is the cornerstone of the American welfare state, the desire was to put in funding for healthcare then. But FDR, whatever you might think of him, very shrewd politician, very shrewd. He understood the power of the AMA, as I was saying, because of the federated structure, having constituent medical societies at every single level, and the way they could lobby at every single level, all the politicians. He knew that putting that in could sink the entire bill, which had Social Security, unemployment benefits, a lot of other things in it. So that got kicked out. But what was happening is there was starting to be more and more calls for the government to get involved in healthcare. Again, the AMA is just hanging on to this 19th century model, just individual physician. Nobody's allowed to prepay. Nobody's allowed to get insurance. They're starting to realize they're not going to be able to keep pushing this line because FDR's administration has a big national conference on it. You start getting legislation for the first time ever, the Wagner bill. Initially, they're just saying, hey, a lot like Medicaid set up today in a lot of programs, the federal government send money to the states and they set up different kinds of healthcare programs, which is the way Medicaid works. You can see it's going to be a perennial issue. And so AMA leaders realize they can't keep crushing the market on one hand and fighting the government. Something's got to give. What they do, they'd already said, okay, fine, we'll allow insurance for people who are poor. They finally allowed that. But in 1937, that's when they sat down in this cigar smoke-filled room that I imagine, because again, it's Chicago and it's this old boys club, and created out of air, just made up the insurance company model. And the insurance company model was going to be and was and is today was that insurance companies would finance healthcare. And in their mind, this would be fine because insurance companies, they were located in one place. They're physicians all over the country. How are they going to possibly be able to monitor all these physicians? And they put rules on it. Physicians had to be paid fee for service. You could not pay them a set fee per patient. Capitation is what we call it. Could not put them on salary. Absolutely not. Fee for service. The insurance companies were told you are not allowed to question how we are practicing medicine. They can fill out a form telling you what they did to get their payment, but you better not even question. And indemnity payment. At that time, believe it or not, physicians just put in whatever they wanted to be paid. That ends up going away. And then we get fee schedules that are developed in the 1950s. But of course, the fees just escalated very rapidly. They came up with this idea in 1937, this insurance company model that everybody, I mean, Democrat, Republican, physician, insurer, everybody looked at this model as like, well, this is going to cause increases in healthcare costs. It doesn't take a genius to see that this is a flawed model. Everybody recognized this, but this is what the AMA decided to go with. And this is what they branded the free market. Again, what they would use their language, their rhetoric then would often be voluntary, their voluntary choice as opposed to government programming. It's a little bit of marketing trickery because this absolutely was not the market. The market would have never produced such a Frankenstein monster of a model that the incentives were so misaligned that was going to cause cost increases. And the insurance companies looked at it, were like, they kind of get dragged into it for political reasons because they're not stupid either. And they did not want to have anything to do with it. They were basically being asked to finance something that they couldn't even forecast the supply of. Much less, they certainly weren't even allowed to ask physicians to not oversupply care.
Right.
So that's their answer to all government intervention. That's what they run with. The Truman campaign was one really big push to reform healthcare. But I think one thing people overlook is because this model was so flawed, it wasn't just Truman. Everybody and their mother was trying to reform healthcare. Eisenhower, lots of Republicans, a lot of healthcare reform bills were offered, a lot like the ACA in the 1950s by bipartisan groups in Congress, but different ways. They were really trying to displace the insurance company model. Everybody recognized that if the insurance company model got really built up in the private sector, it was going to be hard to displace it. By the time they get to Medicare, that's the big breakthrough in 1965 with Medicare and Medicaid. As far as healthcare reform goes, you had reformers in the Social Security office because they were very much reformers pushing this. They weren't just like disinterested government officials who had wanted to displace this model, saying, we wanted to get rid of this model, but it's too late now. We're going to have to work around it, build our program on top of it. And that's why insurance companies administer Medicare. And they built it on the exact same model too, fee for service. In the 50s is when you start to see the insurers starting to get a little bit, it's very gradually and incrementally how they're able to start building up their power over physicians. And the way they're able to do it is because of the political blowback that is occurring at the fact that healthcare costs are skyrocketing. I mean, every year, the policy prices, you see all these jokes in the Health Insurance Trade Association journals about like, you can't skin a cat twice, like just raise it 45% this year so that we don't have to raise it 20% this year and 20% next year.
And this is going on in the 1950s now. So this is the time when we look back and say, well, it's too bad healthcare isn't cheap like it was in the 1950s, but they were complaining then.
I know.
Yeah.
People were complaining. And because the insurers didn't have a lot of control over doctors like they do today, there was a surgery crisis where all these surgeries were being done that were not necessary.
Wow.
It's very scandalous.
It sounds exactly like the whole discussion that led up to and after Obamacare.
Yeah.
Huh.
Think about it. If the insurers weren't allowed to say anything or ask, why are you operating on that person? Again, most physicians, they were responding to incentives, but it was just so encouraging so much rampant fraud, which is so sad because you see hysterectomies being given. So what happens is pathologists start noting like, wait a second, the pathologist in a hospital, it's normal to do appendectomies. And then we test the tissue afterwards and say, oh, this was a healthy appendix. That'll happen 10 to 12% of the time. You tried to make a call, you thought you had it. But when it's 75, 80% of them are healthy,
yeah,
what's going on here? And so that was happening with hysterectomies. And that's actually even kind of meets up with neo-eugenics in a sad way, where you have a lot of Black women and poor white women being preyed upon, or because elite physicians have ideas about who should be allowed to have however many children. But that's a whole nother story. The incentives were lined up in such a way that the AMA wasn't able to keep making the story that they kept going with. Oh, the voluntary system, the private market's so great, this model. I mean, they would show up periodically in front of Congress, and their testimony was always like, here's our progress report with how many more people we've insured, how much more generous our benefits are. Because it was like everybody understood what the debate was. The people who want to reform it are like, we can reform it and make costs cheaper and give you more generous benefits. Whereas the AMA is arguing, no, of course, this is during the Cold War. We don't want socialized medicine. They're falsely selling their model as some kind of free market, free enterprise, American apple pie and mom thing that it wasn't.
Right.
But that was great marketing, right? So the reason the AMA does start to let the insurer incrementally start getting more and more involved in medicine and looking, it starts with a few things. Like they set up what are originally called tissue committees. Now they're called like utilization review committees, or all kinds of PSROs and all kinds of ugly acronyms. But they were committees to start looking over what physicians were doing to patients in the hospital. If you get them in the hospital, that's where you can run up lots of tests and procedures and stuff. So it starts a little bit just because the AMA has to give in if they're going to keep making this political argument. But as you can imagine, year by year, decade by decade, this power the insurance companies have is getting built up to the point that, in the 70s and 80s, you're more and more just having these standardized treatment blueprints that are like, physician, you see this is how you have to treat it if you want to get reimbursed. Or you need to call us first before you can admit somebody to the hospital. And that's the way it is today, an answer from the insurance company and decide whether or not your physician can admit you.
So we're running low on time. This has been excellent, and I'd love to have you on for the next 3 days and just talk about this. But can you tell me briefly, do you have any hope? Where do you see us going in the future? Do you see us coming back to this really cool model you described?
I would love it. And I've said this before, I would love to see that. And the fact that we already have GPs doing this model, what your audience might have heard about this model, but it's really interesting. What everybody heard a lot about before, I would say in the 90s and early 2000s, was concierge medicine, where physicians went away from the insurers.
Right.
But that was for the rich. That was for the elite. The neat thing about the models we're seeing today is this is for Joe Sixpack. This is for regular folks. So you have folks now who are buying a catastrophic policy that only covers them on the back end, like if they run up a really high bill. Because under the ACA, let's face it, we've got to admit the fact that it is not at all worked the way it was supposed to. And people who weren't poor enough to qualify for Medicaid because they were working, but they were like lower middle class or working poor, they're sometimes described as, okay, great, they're given this so-called ACA benefit. If you get a lot of subsidies, that's fine. But a lot of people, especially people who are self-employed and all, the price of insurance shot up because now it had to have all these bells and whistles that the federal government was going to require. So actually people who had before bought individual coverage, not through their employer, a lot of them lost their health care because they couldn't afford anymore. A story you hear over and over again, if you look at the statistics, when you're paying the same cost as a mortgage to cover you and your 3 other people in your family every month, and you still can't use your health insurance because you first have to meet a $3,000, $5,000, or $7,000 deductible to even start dipping into the insurance for that year. And the reason everything's so expensive is because part of the regulation of ACA was, oh, you have to cover this and this. Okay, great. That looks great on paper, but then people can't afford it because you're not giving them just the basic things. And then every single treatment becomes political.
Mm-hmm.
You see this state by state too. Everybody, the chiropractors go down and lobby, our stuff has to be covered. And the acupuncturists go to, and hey, this is all great. I love my chiropractor and acupuncturist, but then everybody has to buy what I want. Right?
Yeah.
So that's what happened with ACA. I think it's great that physicians are getting fed up with the insurance company. The paperwork, it's so sad to see these people who have so much expertise. Think about how valuable their time is per hour, the amount of time they spend in college and residency and med school and all this stuff. And they're spending time filling out paperwork.
Mm-hmm.
You know, the market's broken. That doesn't even make sense when you're looking at an economy that's running well. You have specialized labor and it makes sense, but instead everything is legislated. Doctors going to the state legislature to not let nurses do this because we need to keep it so we can bill for it, because they're not incentivized correctly to think about how you want to divide labor. I would love to see physicians keep going down this entrepreneurial route. And if they start thinking more of multi-specialty and figure out how they can start to take back over the hospitals, because some of these old prepaid groups, they had their own hospitals, or they would just negotiate with the hospital how they were going to do their admissions practices. Some of them had their own surgery facilities, but again, they could own their own labs and everything. Now they can't because it's a conflict of interest, because you don't want them to own the lab and they send every patient over the lab to get labs done so they can get the bill, pass it on to the insurance company. It's this game of cat and mouse between the insurer and the physician. But it's made medicine not as fun to practice too, because in the prepaid physician groups, the doctors would sit down at the end of the day and they'd talk about not the regular person who came in with a cold or the flu, but the elderly person with 3 or 4 different issues and what can we do and how do we treat it, or we can't figure out what this person has. That's a much more exciting way to practice medicine, because you're learning from physicians and other specialties and seeing new things. I think a lot of interesting cases, they just send them to this specialist, they run through the treatment blueprint. Okay, I've done everything I can do that I can bill for, send you to the next one. And they're doing a lot of the same things over and over. And you talk to physicians, it's not all that it's always cracked up to be. It can get very routine.
Thank you so much. This has been wonderful. You have a book out, at least one book out.
Yeah, yes.
You want to mention it? And we'll put a link in the show notes.
The book is Ensuring America's Health, with a colon and then a long sloppy title. It's not sloppy, but it's something that I can't even remember, something about the construction of America's corporate healthcare system. But it's ensuring with an E.
We'll put a link in the show notes. So if anyone wants to follow up, just click on the link. You can get Christy's book. Thank you so much. This has been wonderful.
Yes, thanks so much. I really appreciate you having me, Ann.